Well, today's Debunking the Myth deals with taking supplements. And you know, many physicians tell their patients that taking supplements just gives them expensive urine. Well, Joe has the facts to debunk that myth. And I mentioned vitamin C before the break. You know, that's one of the things that we hear a lot about. But doctors just, you know, aren't always really on board with taking vitamins. Is it a myth that taking all those vitamins? I think I know the answer to this.
Any physician that would make the comment that taking vitamins just gives you expensive urine, my guess is that if I had even a 5 or 10 minute conversation with that individual, I would be able to quickly dispel that notion, even with their agreement. Because I would ask the thing that they always comment on. The first thing they always comment on is what scientific evidence, you know, do you see of that? If they were to say, well, we see that when people take supplements, there's more vitamins in their urine, so therefore you're not utilizing it. That's not you know, congruous evidence mounting there. The other thing is, Shirley, and this is not meant to be critical or divisive to the medical community, but and this is changing as well. But most physicians have a total of 4 hours of nutritional training. Through school.
I think that is changing a little bit, thank goodness.
You know, many of the physicians that I've had involved in my life, you know, they were brilliant in the area that they were working with. You know, and I had this with my child. But you know, as far as nutrition goes, I was more well informed than they were. So, exactly. So that is indeed a myth. So just like the RDA, the recommended daily allowance.
Yeah, let's talk about that for a minute, because you know, people think of, okay, well, if I'm getting the RDA, then I'm okay.
If you're getting the recommended daily allowance, those daily allowances should have been daily minimums to stay alive. That would be kind of a long acronym. But for instance, they came up with the vitamin C one from what does it take to prevent scurvy. The vitamin D RDA came from what does it take to prevent rickets. So
minimal.
Absolutely. So, you know, we like to think in terms of optimal daily allowance. You know, my own acronym of ODA. You know, optimal daily allowance.
Okay.
And for instance, the recommended daily allowance for vitamin C is 60 milligrams. 500 milligrams to 1,000 milligrams, depending on whether you work out or not, would be a much better dose, a much more effective dose of vitamin C. Vitamin D, which we touched on in the first segment, has a RDA of 400 IU. And they always said that, you know, that's fat soluble, yes.
Yeah,
and now they have studies, Shirley, showing 2,000 IU a day consistently.
Wow. With D?
And still their blood levels in the low 40s, which is nowhere near the toxic level. I wouldn't recommend people to supplement 2,000. We're not saying that. No. But certainly 400 RDA 400 IU is not, if they're going to be therapeutic in any way. It's strictly that baseline to kind of survive.
Like a total minimum.
Right.
Yeah, okay. Well, in our email bank, we got a note from Linda in New York, and she writes, even after all the negative data about hormone replacement therapy, some doctors are still prescribing it in smaller doses. Is there any situation where the benefits of HRT do outweigh the risks? And you know, that's a very good question for our resident MD, Dr. Walt Larimore. So let's see what he had to say to that question.
Well, you're right. There was a great deal of negative PR about hormone replacement therapy, or what's called hormone therapy for menopause, a few years back. But we've learned since then that most of that negative PR was because that very large national study was done with older women. What we've learned since is, although hormone therapy does have significant negatives in older women, with younger women, 50, 55, who are going through menopause and suffering from those severe symptoms, that low levels of hormone therapy for as short a time as possible, 6 months to a year, in most women has more benefit than risk. Is there risk? Yes, there's risk to any therapy, and you should know what those risks are. But I think our job as doctors and patients is to weigh the benefit-risk ratio. What are our options of therapies? What's the benefit? What's the risk? What's the upside? What's the downside? What's the cost? And with that information, we can make a wise decision.
Well, he's one of the few doctors who really see the benefit, and but like you said, more and more doctors are coming around and they're realizing that you...
Yeah, sure. I think HRT has been one of the disasters of modern medicine. I really do.
I feel like I was lied to. I was deceived.
I'd recommend almost any treatment option before that. Well, listen, for a copy of the show, today's show, call 888-242-9393. Coming up, the amount of supplements you hear about and see in the store could scare you away from taking any altogether. But after the break, we are going to answer the questions you sent in on supplements. Stay tuned for your answers.
Well, welcome back to Balanced Health. You know, between 1997 and 2002, the supplement industry experienced a 34% jump in sales to more than $19 billion annually. That's huge. But many people still have questions about taking them. So let's answer some of those questions. And Joe, I have a good one here. Do any supplements interfere with my medication?
Well, if you use supplements as a broad-based, the term is often vitamin supplements, and it's kind of a misnomer because there's so many different types of supplements, okay? A dietary supplement is anything that's put into a form other than what we would typically consider on our plate for food. So in that regard, the answer is absolutely yes. It can affect your medication. Herbs especially.
Right.
Any type of herb, all pharmaceuticals, all drugs are herbal-based.
Sure.
So yes, there's going to be some contraindications there. And then when we go into the vitamins, stuff like vitamin K, which has gotten tremendous amount of press recently for not only for its health for keeping good circulation and stop clotting, platelets from clotting, but also for building strong bones. So it's become very popular with people 50 and over. But some of those people are also on blood thinners like warfarin or Coumadin, and you'd never want to take those two things together.
Right, well, one really good rule of thumb, is that, when you go into the doctor's office and they put what medications are you on, it's very important to put down if you're taking vitamin supplements, if you're taking herbs, right?
It really is.
I mean, that's very important to give your doctor that information.
Where it can be a little bit difficult is sometimes the physician, just because of the litigative society we live in, might say, just go off all of it.
Yeah.
Why would he or she want to mess with it, No. And if that happens, surely what we tell our viewers is, well, ask why.
Yeah. And which ones? Which ones are the problem?
If he says to you, well, look, you're on blood thinners and vitamin K is a blood thinner and you could wind up that's a pretty good reason.
Yeah,
okay?
Sure.
But if he just says or she just says, it's not worth it, so that to me does not fly. But we got a call from a question from a viewer here. We have a call. It's Renee from Virginia. Renee, what's your question? How can we help you?
I would like to know about Kylie, why he does not carry his garlic, or I've been told that he has done away with his garlic products. And I'm very concerned about that. And if he can answer that, I would appreciate it. And if there is a place to get it, does he have an 800 number to order it? Thank you, and may God bless you all.
Well, the she's talking about is you, and unfortunately, she has a legitimate concern because you're not selling your garlic.
No, we're not. We have always operated our business before God. My prayer has always been, Lord, first and foremost, if we're selling these things to help people's bodies. We want to do. If we're not doing that, then we're nothing. Okay, and surely the research with supplemental garlic was just overwhelming. Not that it wasn't doing any good, but it was overwhelming that all you have to do is take one clove of raw garlic. We actually did the math. One small clove of raw garlic, the Allison count in that was equivalent to about 20 capsules.
Oh, my goodness. Are you serious?
Yes.
Well, that's potent stuff.
It is potent. Well, it is. Raw garlic is potent stuff. But I love it. I'll actually warm it up and use it like butter on bread. But, of course, I'm Italian. But you could even take just a very small piece of garlic and put it in a blender with a green drink, which is what I do.
Sure. Oh, that's a good idea.
All the garlic you need. So,
that's a good idea.
And again, so much of what we did, Shirley, when we made the Total Living Drink, we canceled about 8 products for the Total Living Drink.
And that's what I think what was her name in Virginia?
Yeah.
But that's.
But garlic's not in there, so that's probably what she was asking.
But that's why that Kylie did reduce a lot of their products because it all got put into the Total Living Drink, which is good. Well, we also have our email box today. We received a wonderful suggestion from Renee in California. Let me go ahead and put this in right here, Joe, because I think this is such an absolutely wonderful suggestion. And she's talking about baking soda for canker sores. And I haven't gotten these for a long time. I like to think my body's healthier, but I used to get them a lot, as a younger person, and they are so painful, and they can last for weeks. And she says you put a paste of baking soda, bicarbonate of soda, just common baking soda, and let it dissolve in your mouth and put that on there every couple hours, and they go away quickly.
Well, you actually apply it to the sore.
Right, you put it right on the sore. Right.
And it is amazing. It breaks down that sore and basically dissolves it. I've heard people also using milk of magnesia. There must be some of the same similar components in it.